Good day everyone. I will explain about the psychology of harmful behavior. Harmful behavior are the actions that undermine current or future health. They include several key characteristics: habitual and addictive. It often starts early and tend to group together into harmful habits. Window of vulnerability in adolescence. Adolescence is a particularly sensitive period, although some people may begin even earlier. Influenced by peer pressure. People may engage in them for admiration. Pleasurable and help to cope with stress. They provide a short-term relief but are harmful long-term. Develop gradually. Harmful habits form slowly over time. Have similar causative factor. They often link to family conflict or poor self-control, common in the lower social class, due to the high stress and harmful environment. Now I will talk about smoking. Smoking is the leading cause of preventable death and killing over 8 million people annually. It can cause lung cancer, and secondhand smoke also harm non-smokers. People start to smoke because of several reasons. Some begin because they have low awareness of harm and high expected benefit. They think smoking does not harm them much but expect it to make them feel good. Another strong factor is peer influence and social modeling. When friends smoke, people are likely to copy the behavior. Furthermore, media influence can make smoking appear attractive. Smoking also has synergistic effect, meaning it increases the impact of other problems. Smoking amplifies the harmful effect of cholesterol, stress, low body weight, and inactivity. Smoking combined with depression will increase the possibility of cancer, and if combined with anxiety, will increase the possibility of panic attack. Next, I will explain about several factors that contribute to smoking behavior, starting with reinforcement. Positive reinforcement, the taste or sensation makes smoking enjoyable. Negative reinforcement, it temporarily relieves tension but can strengthen the habit. Biological factors also contribute: genetic predisposition, which increase nicotine addiction possibility. Prenatal nicotine exposure raises the chance of later smoking, and the insulin in the brain. Stress also connected to smoking. Higher stress leads to more frequent smoking. Smoking gives a short-term relief but creates a harmful cycle. Smoking can cause serious effects. Smoking leads to cancer due to carcinogen in tar. In addition, it also can contribute to cardiovascular conditions, which include CHD and stroke. Finally, I will explain about why smoking is so hard to change and how it can be reduced. Smoking is hard to change because drug addiction and early positive association make the habit deeply rooted. Personalized smoking pattern, people build cigarette into their daily routine. Withdrawal symptoms make the process uncomfortable. Many believe smoking can reduce anxiety and improve their mood, so they rely on it emotionally. Many underestimate the long-term benefit, which reduce the motivation. However, there are effective ways to reduce smoking. Change attitude towards smoking through education. Use a therapeutic approach, for example, like counseling. Nicotine replacement therapy to reduce the withdrawal symptom. Behavioral intervention that targeted habit. Provide social support and stress management, helping people manage their life without cigarette. Relapse prevention, because stop smoking requires long-term effort and follow-up.
Good day everyone. Now I will be presenting the drugs and drug addiction. So what is drugs? Drugs is any substances that can affect your body and your brain. When a person takes a drug, it travels to the body and interferes with the brain's neurotransmitter. This means the drugs can change the way we think, feel, or behave. Drugs are not only illegal substances, they also include prescription medication, over-the-counter medical, alcohol, tobacco, and even caffeine. And there are two main categories of drugs. The first is pharmaceutical drugs such as aspirin, paracetamol, or preferred medicines usually used for treatment. The second category is recreational drugs, which people take for pleasure like alcohol, nicotine, and caffeine. Drug abuse can group into three types. The first type is depressant, which slow down brain activity, example including sleeping pills and heroin. The second type is stimulant, which increase brain activity and make a person feel more alert. This can cause a rapid heartbeat, high blood pressure, and irritation. Example including cocaine, amphetamines. The third type is hallucination, which cause hallucination or distorted perception. Example include like LSD, ecstasy, and mescaline. And these are commonly drugs that abuse, including marijuana, cocaine, heroin, alcohol perception drugs, and inhalers. Even things we see every day, such as sedatives or cigarettes, can be harmful when used excessively. So, a drug addiction is chronic brain disease. It causes a person to continuously sense and use drugs even when they know the negative consequence. Although the first decision to take drugs may be voluntary, repeated use changes the brain. These changes reduce self-control and make it extremely difficult to restrain cravings. Because these brain changes can last a long time, addiction is known as a relapsing disease, meaning people can return to drug use even after years of stopping. Drug addiction usually begins with drug use, then becomes drug dependence, and finally leads to abuse, where body physically needs the drugs. This circle creates tolerance, meaning the person needs more and more of the substances to get the same effect. And what happens in the brains after take drugs? So most drugs activate the brain's reward system, like flooding with dopamine, a chemical that makes you feel good. This strong pleasure makes the person want to repeat and repeat the behavior. Over the time, the brain becomes used to the extra dopamine. So normal activity like eating, spending time with family will feel less enjoyable. In long-term drug use also damage area of brain involved in judgment, decision-making, memories, and learning ability. This is why addiction is so hard to control. Then, why do people start taking drugs? Some reasons including curiosity, stress, peer pressure, wanting to fit in, rejection, or having incorrect information about drug effects. Addiction can also be understood through 5 Cs. It is chronic, meaning long lasting. There's a loss of control. There's a compulsion where the person feels forced to use the drugs. They continue despite negative consequences and they experience strong cravings. So, who is at the risk of drug addiction? Biological factors such as genetic and gender. People with mental health problems like depression or anxiety are also more likely to become addicted. Environmental factors like family problems, stress, or peer influences also play a major role, and starting drug at a young age increase the risk even more because the teenager brain is still developing. And finally, it is important to understand the differences between abuse, addiction, and tolerance. Drug abuse is use substances in the wrong way, and addiction is when a person cannot stop it to take the drugs repeat and repeat again. Tolerance is when the usual amount no longer works and the person needs more and more again. That's all for me. Thank you.
Good day, everyone. Today I'll be talking about nutritional disorders, starting with obesity. So, obesity happens when there is an excessive amount of body fat in our body. So, it is a serious condition because it increases the risk of many health problems such as heart disease, diabetes, high blood pressure, sleep apnea, and also fatty liver disease. So there are a few common causes of obesity. The first one is eating too much high calories foods and sugary drinks. The second is lack of physical activity, especially in our modern lifestyle. So the third one is genetic and family habits also play a role. And so do social economic and psychological factors such as stress and low income. Next is childhood obesity. So childhood obesity means a child is weighing far above the healthy range for their age and height. This is worrying because unhealthy habits formed during childhood often continue into adulthood. To prevent obesity, some simple strategies include parents should lead by example, encouraging healthy snacks, teaching the children's patience with foods, maintaining a good sleep habits, and also using non-food rewards instead of sweets. So these are the small steps can help build a healthier lifestyle. Next, I will talk about the two common eating disorders, which is anorexia nervosa and bulimia nervosa. So anorexia nervosa involves a drastic reduction in food intake. People with anorexia have an intense fear of gaining weight, even when they are already very thin. They also have a distorted body image. They might feel fat even though they are underweight. If not treated, anorexia can lead to very serious consequences such as kidney failure, heart problems, and also even death due to extreme starvation. On the other hand, bulimia nervosa is different. It involves a cycle where the person eats a large amount of food in a short time, known as binge eating, and then tries to remove the calories by vomiting, taking laxatives, or exercising too much. So bulimia is often triggered when the stress is high or when someone feels very negative about themselves. It can lead to inflammation of digestive system, heart rhythm problems, and long-term depression or feeling of guilt. So both disorders require serious medical attention and emotional support. For the last slide, I will cover basic nutrition. There is a saying, you are what you eat, and it is true because our diet affects our appearance, energy levels, mood, and long-term health. So our body needs six important nutrients. First is water, which is needed for hydration and metabolism. Second is the carbohydrates for main source of energy. Third is protein, which help growth and repairing our body tissues. Fourth is fats, which store energy and support cell functions. And the fifth and sixth are vitamins and minerals, which keep our immune system strong and help our body function properly. A balanced diet can improve our immune system, weight control, mental clarity, and overall well-being. So one recommended eating pattern is the DASH diet. It focuses on whole grains, fruits, vegetables, lean protein, low-fat dairy, and food in low sugar and saturated fats. So this diet is also very helpful for lowering blood pressure. So overall, good nutrition supports a healthier and better quality of life.
I will be presenting about motor neuron disease and lung disease. We will start with motor neuron disease. These are conditions where nerve cells that carry message from your brain to your muscle progressively degenerate. There are two main types, upper motor neuron in the brain and lower motor neuron in the spinal cord. When these cells die, the message can get through, leading to a loss of movement control. The most common MLD is amyotrophic lateral sclerosis or ALS. It affects both upper and lower motor neuron, causing a gradual loss of muscle control for walking, talking, and even breathing. Symptoms typically begin between age 14 and 16, and while progression varies, it is a serious condition with no known cure. Beyond ALS, there are other forms of MLD. Primary lateral sclerosis or PLS is affect only the upper motor neuron, causing weakness and stiffness, but is not fatal. Progressive bulbar palsy is a form of LLS that damages brainstem neurons, severely affecting speech and swallowing. A related condition, bulbar palsy, has similar effect and can cause uncontrollably laughing or crying. Other than that, progressive muscular atrophy affects lower motor neurons, starting with weakness in the hands. It can sometimes develop into LLS. Spinal muscular atrophy is an inherited form caused by genetic defect with type ranging in severity from infancy to adulthood. While there is no cure for any MLD, the focus is on managing symptoms and improving quality of life through a multidisciplinary approach. This includes specialized clinic, physiotherapy, speech and language therapy, and dietary advice. Medication can help. For example, Rizuli can slightly slow the progression of ALLs, while other drugs help manage symptoms like muscle stiffness. Now, let's shift our focus to the lungs, which are responsible for delivering vital oxygen to our bloodstream. Lung disease is umbrella term for many disorders like asthma, cancer, and infection that make breathing difficult and can lead to respiratory failure. One rare disease is pulmonary fibrosis. It is a group of diseases that scar and thicken your lung tissue. It attacks your alveoli, the tiny scar in your lung. This makes it very hard to get oxygen. It is a progressive and terminal illness with no cure. The main symptom is shortness of breath during simple tasks. The disease can get worse quickly in months or slowly over years. Another major lung disease is COPD. COPD is a chronic inflammatory disease. It causes blocked airflow from your lung. The main cause is long-term exposure to irritants like cigarette smoke. It includes two main conditions. First, chronic bronchitis is inflammation of your bronchial tubes. It causes a daily cough and mucus. Second, emphysema is the destruction of your alveoli. The good news is COPD is treatable. With good management, Binti can control the system and have a good quality of life. What are the signs of COPD? The symptoms usually appear only after your lungs are already damaged. Common signs are shortness of breath, wheezing, and a chronic cough with mucus. People feel chest thickness and get frequent respiratory infection. They often lack energy. In later stage, they can be unintended weight loss. People also experience exacerbation. These are times when their systems suddenly become much worse.
Hello everyone, today I will be talking about Parkinson's disease. Parkinson is a brain disorders that affect movement, causing shaking, stiffness, and difficulties with walking, balance, and coordinations. Symptoms usually start gradually and worsen over time. Parkinson's disease can affect both men and women, but is more common in men. Most people develop the disease around the age of 60, but 5% to 10% of people develop early onset Parkinson's disease before the age of 50. The disease is caused by the loss of nerve cell in the basal ganglia, which produce dopamine, which is a chemical needed for smooth movement. People also lost norepinephrine, which can cause the fatigue and low blood pressures. In most cases, Parkinson occurs randomly due to the combinations of genetics and environmental factors. Some cases are hereditary, but they are less common. Next, we will look at the symptoms, diagnosis, and treatments of Parkinson's disease. The four main symptoms are tremor, stiffness, slowness of movement, and impaired balance, which can lead to falls. Other symptoms may include depressions, sleep problems, difficulty swallowing or speaking, constipations, and urinary issues. Early signs are often subtle like soft speech, small handwritings, reduced facial expressions, or shuffling gait with small steps. Diagnosis is based on a medical histories, neurological exams, and response to medications, as there are no definitive tests of most cases. Currently, there is no cure. Medications, surgeries, or therapies can help to relieve the symptoms and improve their quality of life. Now we will talk about cardiovascular disease or CVDs. CVDs are disorders of the hearts and blood vessels. They include coronary heart disease, cerebral vascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart disease, and deep veins thrombosis or pulmonary embolisms. Heart attacks and strokes are usually caused by the blockage in blood vessels, often from the fatty deposits. Stroke can also result from bleedings in the brain. Major risk factors include unhealthy diets, physical inactivities, tobacco use, and harmful alcohol consumptions. This can lead to high blood pressures, high blood sugars, high cholesterol, and obesities. Due to these activities, it will increasing the risk of heart attacks and strokes. A healthy lifestyle like quitting tobaccos, reducing salts, eating more fruits and vegetables, exercising regularly, and avoiding harmful alcohol can greatly reduce the risk of CVDs. Next, we will look at the symptoms of heart attacks, strokes, and rheumatic heart disease. Heart attack symptoms include chest pain, pain in the arms, shoulders, jaw, or back, shortness of the breath, nausea, and cold sweats. Stroke symptoms include sudden weakness or numbness of one side of the body, confusions, difficulty speaking, vision problems, dizziness, severe headaches, or faintings. Rheumatic heart disease results from the heart damage caused by the rheumatic fevers, usually from the streptococcus infections in children. Symptoms include shortness of breath, fatigues, irregular heartbeats, chest pain, and faintings. Rheumatic fevers can also cause fevers, joint pains, and nausea. Early detections, healthy lifestyle changes, and proper medical care can help reduce risk and improve outcomes.
I will be presenting about terminal illness, cancer, and AIDS. A terminal illness is a disease that cannot be cured and will eventually lead to death. It is sometimes called a life-limiting condition. People with terminal illness may suffer from one or multiple related diseases. Examples include cancer, dementia, motor neuron disease, lung disease, neurological disease such as Parkinson's, and heart disease. When facing a terminal illness, people often experience emotional changes described by the Kubler-Ross model, also known as the DEPDA stages. The first stage is denial, where the person refuses to believe the diagnosis. The second is anger, where they may ask, "Why me?" or blame others. The third stage is bargaining, where individuals try to negotiate. For example, promising to change their lifestyle or praying for more time. The fourth stage is depression, when sadness and hopelessness set in. Finally, the last stage is acceptance, where the person becomes calm and prepares emotionally for what is to come. These stages do not always happen in order, but they help us understand how people cope emotionally with terminal illness. Cancer is one of the most feared terminal illnesses. It occurs when cells in the body grow uncontrollably and spread. There are 5 major types of cancer. First is carcinomas. These cancers start in the skin or the lining of internal organs like the stomach, lungs, intestines, or reproductive organs. They are the most common type of cancer, which about 85% of all cancers are carcinomas. Second is melanomas, which are special skin cells that produce melanin, the pigment that gives skin its color. The next one is lymphomas, begin in the lymphatic system, which is part of the body's immune system. Fourth is sarcomas. Sarcomas start in muscles, bones, or connective tissues. The last one is leukemias, which are cancers of the blood-forming organs, especially the bone marrow that produce extreme proliferation of white blood cells. Cancer risk increases with age, which about 78% of cases happen in people aged 55 and above. It is also more common in males. Lifestyle and environmental factors, such as diet, smoking, and exposure to chemicals, contribute to cancer development. There are 3 main medical treatments for cancer. First is surgery, which is a treatment used to eliminate a neoplasm. Second is radiation therapy, which is used in 2 ways. External beam therapy, which uses high-energy beams to destroy cancer cells. And internal radiation therapy, which involves applying radioactive material within the body. Third is chemotherapy, which uses powerful drugs to kill fast-dividing cells. However, chemotherapy also affects normal cells, causing side effects such as hair loss, nausea, and weakened immunity. Cancer has strong psychological effects. Patients often feel fear, loss of control, and emotional stress. Their relationship may change because friends and family may not know how to support them. Some patients also withdraw socially due to their physical appearance or treatment side effects. Psychosocial interventions include relaxation training, imagery, and cognitive behavioral therapy help patients to cope. Support groups also help patients share their experiences and reduce loneliness. Stress management programs have been shown to reduce depression, lower anxiety levels, and even improve immune functioning among cancer patients. Acquired immune deficiency syndrome, also known as AIDS, is a relatively new disease, first recognized around 1980. It is an infectious disease caused by the HIV virus, and it spreads through shared contact of blood and semen. In developed countries, AIDS death rates are lower due to better treatment. Globally, AIDS remains a major epidemic with 2.3 million new infections and 1.6 million deaths per year. It is most common in young adults aged 20 to 29, and the infection rate is higher among men. The highest number of cases in the world is in sub-Saharan Africa. After a person is infected with HIV, there may be no symptoms for years. During this time, the virus hides and continues attacking the immune system. Eventually, the person develops symptoms such as fever, night sweats, fatigue, diarrhea, and weight loss. AIDS is diagnosed when the immune system is extremely weak and opportunistic infections begin to occur. The main treatment for HIV or AIDS is an antiretroviral therapy or ART. These medications uses drugs that suppress HIV reproduction and reduce viral load dramatically. It also prevents transmission to uninfected partners and help the person live a longer life. However, ART only works when taken consistently every day. Some patients struggle with adherence due to cost, side effects, or emotional stress. HIV or AIDS carries strong stigma. Many people hesitate to get tested or seek treatment because they fear discrimination. In extreme cases, people living with HIV may be judged, avoided, or blamed for their illness. Depression is common and can speed up the progression of HIV. It also leads to lower medication adherence and risky behaviors. Counseling, stress management, and cognitive behavioral therapy help patients cope with the emotional burden of HIV. Support groups also build a sense of community and reduce isolation. Research shows that when emotional well-being improves, patients show better adherence to ART and have lower viral loads.